for some people as part of being considered to deal with the Indian coronavirus variant. Israel is placing its troops along the Gaza frontier, and Hamas militants have fired more rockets over the border. The Welsh Government has confirmed pubs and restaurants and entertainment venues can reopen indoors from Monday. The weather cloudy with showers for many, a high of 15 degrees.
LBC Travel, I'm Joanne. We're very slow on the M40 northbound up to junction 6 at Watlington. It's because of an accident where one lane is closed. Long delays this morning northbound to the Blackwall Tunnel. It's slow from before the Sun in the Sands back onto the A2. Not being helped by the fact the Woolwich Ferry is not running today because of a strike. On the Underground, there are severe delays now in both directions on the Circle Line, and Great Western Railway and London North Eastern Railway. Still lots of cancellations throughout today because of the ongoing safety checks.
This is LBC.
Look at you in the
Ferrari now. 0345 6060 973. LBC. Ferrari at breakfast. Call 0345 6060 973.
8 minutes before 8 is the time. Dame Cressida Dick with us, of course, straight after 8. Let's come back to our conversation. We'll suspend what we're saying about Israel and Gaza in a moment. Come back to our conversation concerning coronavirus. And if you were listening to me this week, you'll know that I benefited from my second or booster early this week, and can I urge you, if you get the opportunity, for the love of all that's holy, keep that appointment, get there, have the first dose, have the second dose. It is crucial. None of us are safe, and all of us are safe. And I say this with relevance to the headlines that I'm going to discuss now with a man who knows far more about this than I. I speak of Vaccines Minister Nadhim Zahawi. There are concerns, Minister. Thank you for coming on the show. Race to stop Indian strain is one headline. Easter jabs for millions to combat the variant. Minister, how concerned are you and your colleagues? Good morning.
Good morning, Nick. So the B1617.2, which is one of three strains that were first found in India, is the one that is a variant of concern because the rate of infection. So last week it was 520 people. This week is 1,313 people. We've identified, I think, about 4,400 cases and have contacted 14,000 of their close contacts. Today, we're announcing a surge testing program. 100 nurses, public health practitioners, environmental health practitioners going to Bolton and Formby, door-to-door knocking, a mobile testing unit for PCR tests. Please take advantage of those tests and get yourself tested. We've delivered 800,000 PCR tests around England to 15 areas where we are surge testing at scale, and then genome sequencing. And the most important bit, to add to what you've just said, which is to get your vaccine, is if you are found to be positive, please isolate immediately, because the way we break the cycle of infection of this variant is to make sure that we obviously test people, genome sequence, and then isolate. Isolate is the message if you are found to be positive. I know it's the second day of Eid after the month of Ramadan. People are anxious to meet each other in the Muslim community and other communities as well. But just please be careful and do take advantage of those tests.
Just picking up on that, Minister, I note that some of the areas where this additional testing will be Bolton and Blackburn. These are areas that have quite heavy numbers of people of Asian origin living there. Is that tracked back to the Indian strain, or it's just a pure coincidence? Nadhim Zahawi.
So Public Health England have said, obviously, the Indian strain is from obviously travel, and people before India was on the red list clearly could have travelled and have caught the infection and then transmitted it. The important thing now is to make sure that we, effectively do what we've done before. We did it in parts of London, I think Lambeth, a few weeks back, where we go door to door, we surge test, we sequence, genome sequence, and then isolate rapidly. And that's how you break the cycle. Now, the good news is there is no evidence that this variant delivers a more severe disease in terms of the individual or hospitalization, nor is there any evidence that it evades the vaccine.
So it's not resistant to AZ or Moderna or Pfizer or whatever it might be, Minister, to our knowledge.
Our knowledge, there is no evidence to suggest that. We're waiting for further, obviously, clinical advice on that. The important thing is, if you remember the 4 tests, vaccines at scale, make sure that the vaccines continue to be effective against the virus. 3, infection rates, keep them down, keep suppressing them, and variants. So this is all part of suppressing the infections. Why? Because viruses get desperate to survive. They mutate by infecting people, and the thing we have to stop is that infection rate and suppress, bear down on it as hard as we can. You
and your colleagues will be studying this more closely than I am, Minister, but I note each day I give the fantastic success that you and everyone else has achieved with the first dose, with the booster dose. But I note for the last 4 or 5 days, the number of infections having gone down in a rolling 7-day average for weeks. Actually, Mr. Zahawi, I think the last 4 or 5 days is actually starting to tick up. This morning it's up by 12 percentage points in a rolling 7-day average. New infections, 2,657. Does that again speak to concerns about the so-called Indian strain? Mr. Zahawi.
Exactly right, Nick. So if you look at the rolling 7-day average on infections, they are up by 12.4%. Hospitalization is down by 7.9% down. And deaths are down by 16%. That is good news, because it tells you that the vaccines are clearly working in terms of hospitalization and severe infection and deaths.
All right.
But the infection rate is what is concerning, which is why we have to surge test, do the sequencing, and then isolate. Listeners can help us by taking advantage of the lateral flow test. Look, I've got one right here.
Yes, I see it. Yep, in the blue box. Yep.
Right, twice a week. And then if you're positive, do your PCR test for free in those 15 areas. If you're found to be positive, isolate, because that's how we break the cycle of transmission.
Let me ask you this, and we have been fairly candid with each other down these past few months. Is there now possibility of the next step on the roadmap, i.e. June 21st? This could now actually have to be put on ice. Mr. Zahawi.
So the real, the important thing to remember is that the 4 weeks plus 1 period was real and was deliberate. Why? Because it gives us enough time to collect the evidence, the data, as Chris Whitty described it in the sort of early press conference when we announced the roadmap, and then to be able to analyse it. So Monday is still on because obviously hospitalisation.
Sure, I realise that, but my eye is really looking a little further. I have to put it to you again. There is a possibility then that we might have to press pause as part of June 21.
And the way we don't have to do that is by everybody doing their bit by taking the 2 tests a week.
You didn't say no.
Your PCR tests in those areas, and to isolate, because we've got to break the cycle of infection, because one of those big tests was infection rates have to be suppressed, and the other big test is variants. If those cause us a problem, then the tests will fail. The 4 tests have to be met for the 21st of June.
Much as I enjoy our time together, I only time for a couple more questions because I've got the Commissioner of the Met waiting to get in, so just a couple of last ones. When you were in receipt of text messages from David Cameron, how did you respond, Minister?
Well, I responded as David Cameron has said, which is he asked for Richard Sharp's number, who's the special advisor, was the special advisor in Treasury, and I gave him that number. I maybe misphrased that. How did you react emotionally? What did you think? Wow, here's the former boss on the line. How did you? I don't know what I'd think if Mr. Murdoch was to suddenly text me. Well, look, the way I react is I react to David Cameron or anyone else. And in that case, he wasn't asking me to do anything other than give him a phone number. If there are issues that are to do with my role as a minister or my department, is I refer them to my officials and they deal with them in the correct.
And lastly, he used to sign them off Love DC. Does the boss now sign off Love BJ? No, he doesn't. He signs off as Comrade. Comrade. Well, thank you, Comrade. Good speaking with you, Minister. Best to your family. Have a safe weekend. It's 8 o'clock on LBC. Dame Cressida, most senior copper in the land, here taking your calls after this.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, second vaccine doses could be brought forward as the government considers how to respond to the Indian coronavirus variant. Ministers also aren't ruling out local lockdowns. Cases